The importance of bedside reporting with an emphasis on medical surgical units by RKing. Bedside reporting is an important aspect to nursing because the focus of nursing has always been the patient. The care that we as nurses provide directly impacts patient safety, satisfaction, as well as their improvement or decline in health. Bedside reporting creates an environment that the world of healthcare promotes and desires. As nurses, the quality of care that is perceived by the patient reflects on the nurse. We, the nurses, are defined by the care we give. It is also important to the public, considering nurses are caring for numerous individuals of society, one at a time. It has been said that nurses are the most trusted profession. In order to continue this legacy and retain the ability to positively affect the communities we serve, we must consider every aspect of care and how it can be provided best. By evaluating reliable research, we can observe the importance of bedside reporting and how it can improve healthcare with a few easy steps applicable to every nurse in patient care. So what are the effects of bedside reporting on a medical surgical floor? Well, of course, my population is going to be medical surgical patients and the nurses caring for them. As mentioned before, the intervention is going to be bedside reporting versus the in-comparison intervention, which is the practice of giving patient reports outside of the patient room, away from the patient. Usually, we find that happening at the nurse's station. The outcome that we desire is increased communication, patient safety, and patient satisfaction. We're always looking for quality improvement, and all of those things add to that. And of course, if in a study, we would have wanted a time frame around 3 months. If only one unit was to participate, this would allow adequate time for different demographics to come through, different nurses to also work and sift through different shifts. It would also depend on nurse-to-patient ratios as well as how many beds were in the hospital. So that time is just kind of like a hypothetical time frame we would use. So again, just to reiterate, the goal of bedside reporting, it is patient safety, number one. It's always our number one. Increased communication and increased patient satisfaction. When our patients are satisfied, that means we're doing something right. So that is definitely one of our goals. Well, how do we know bedside reporting is really important? Well, first thing we do is we do a little research. I used a few different databases as listed right here. Most of them are related to medicine or nursing. And what I did is I used a few different combinations of keywords to find my results. Those included medical surgical patients, bedside reporting, safety, nursing, patient satisfaction. Now, as you can see, I've listed that I use bedside reporting in a generic library database that is provided through my university, and that showed over 20,000 results. Of course, that's too many, and that's not very specific to what we're looking for. So I use limiters, and those limiters that I used included changing the time frame and when the article or the journal was published. It also included what kind of journal it was or what kind of study was performed. Once the combinations were used, the number dropped to as low as 12. And at times, I didn't get any results depending on the combination that I used. So with that happen, I just reconstructed my search and was able to find specific results. So the combination of articles used for this review were specific to bedside nursing. They were chosen based on their credibility, and these articles were required to have a focus on patient care, number one, and of course, nurse involvement. So what did I find? Well, as I said before, our focus is patient safety, patient satisfaction, quality improvement, and where does the nurse, in her opinion, fit in? So starting with patient safety, bedside reporting allows an early first assessment for the oncoming nurse. the two nurses will go in the room, and the oncoming nurse can see that she's got a whole bag of fluids hanging, brand new, or the tubing's out of the way, the bed is lowered, the patient's being warm and dry, and she's talking, he or she's talking. So this assessment that's even before your real shift begins allows you to assess the patient. This is providing safety right at the beginning, which is our number one goal. Another thing that provides patient safety through bedside reporting is medication errors and informational accuracies may be eliminated. So consider this. We have several medications that may be specially mixed by pharmacy, such as different antibiotics. And maybe the nurse would have forgotten unless she walked in and saw that it was hanging. And she could tell the oncoming nurse, well, oh, by the way, we have a specific medication for this patient. Or maybe there's a medication that looks similar to another one that the patient is taking, or has a similar name. This is a great time for clarification. Also, you can clarify whether the patient knows they're taking it, and if they have any allergies. Maybe the patient would pipe up if they, heard what the nurses are talking about. That's important involvement with the patient there, as well as informational inaccuracies being clarified. So by having that transparency in front of the patient, explaining what's happening in their care, or explaining history of the patient, etc., the patient can actually be involved and say, actually, this is true or this isn't true. So you're clarifying information because communication is directly related to patient safety, which is my next point. So all that to say, communication with the patient present can allow for a lot more accountability. Patient satisfaction. Patients show increased satisfaction when they feel that they are informed and part of the conversation about their care. Patients often feel as though they lose control of their health or their decisions when they're in the hospital because they don't feel informed or part of the conversation. So by including the patient in bedside reporting, we're giving them the opportunity to not only be informed, but also to pipe up and say, this is what I think about that. And we can ask them questions and make them feel like they are actually part of their care plan. If a patient is satisfied with their care, this will reflect on the nurse as well as on the facility, influencing state evaluation. And we all know what that looks like. The number of calls from the call light are noted to decrease as well. It just goes to say that patients seemingly seem a little less neglected when they've been seen. They're not waiting for the nurse to come in for an hour for the nurse to come in for the first assessment and then another hour for their medicine and wondering where they are. So by going in first thing, they feel as though they're remembered and likely less likely to call out on their call light. Other findings include quality improvement. Bedside reporting includes the patient, which it promotes awareness in the patient and family to make choices in their care. We're kind of going back to the same thing about patient satisfaction. We're satisfied when we're included. And if someone's talking about us and we don't know what's going on, we're not going to be satisfied, and that's going to reflect poorly on us. But the big thing with healthcare is we always want patients to be involved with their care so they can make choices. It's their health, it's their body. We want them to be proactive in their health decisions. So by doing bedside reporting, that is going to promote their awareness and their activity, their proactiveness in their choices. So quality improvement, accountability between staff increases. Reporting at bedside decreases the amount of time patient is left alone, as I mentioned before, as this is one of their common complaints. Although it may take more time, it will decrease the anxiety of both nurse and patient, allowing for a more relaxed care environment. The big thing here is we, as nurses, we've all had that night where we get to work and we're starting off okay until someone's blood sugar drops or someone starts bleeding. And that situation takes a little while to address. But in that hour that we lose, we've not seen 2 or 3 of our other patients. And that will increase our anxiety. That increases the danger to patients as well. So by coming in and doing bedside reporting first thing, you've seen your patients. It causes both the patient and the nurse to have less anxiety, and you can say that you've seen your patients before anything else happens. Lastly, the response from nurses is our biggest barrier. And that's because of non-compliance. And we all love, as nurses, we all love our time. We squeeze all the time we can out of every second. And because of the required time it takes to do bedside reporting, a lot of nurses don't want to do it. But there are solutions, such as bundling assignments. Nurses were also concerned about HIPAA violations in rooms that weren't private. This is a really, really good consideration, especially as a nurse. And there are also solutions for that as well. Lastly, as the practice becomes habit, it is shown that nurses also favor the practice because it promotes accountability and teamwork between coworkers. So overall, there is ample evidence to support this change in practice. There are few barriers which are flexible enough to allow solutions. We see that bedside reporting has a positive effect on the patient, the nurse, and the facility as a whole. The greatest barrier is nurse compliance, which requires reinforcement and promotion. Another barrier is confidentiality, and that's always a patient's choice. So by enforcing bedside reporting on medical surgical units and simply asking the patient before discussing their information in non-private rooms, we eliminate the barriers to this practice. The result, favorably, is safer, satisfied patients and well-equipped, more aware nurses.